Good afternoon. I'm Councillor Graham Bridgman and I am Deputy Leader of the Council. I'm also the Executive Portfolio Holder for Health and Wellbeing, and I am Chairman of this board. Members of the board and guests. This is the first public meeting of the Council or any of its committees or boards since the death of the Duke of Edinburgh. I would therefore ask that we observe a minute's silence to reflect upon his passing, his years of public service, and the loss to Her Majesty the Queen of her husband and liege man of so many years. Thank you. I'm supported this evening by Councillor Joe Stewart, who is the Vice Chairman of the board, and the other members in attendance are Councillors Dominic Burke, Martha Vickers, and Steve Masters. We also have Nick Carter, the Chief Executive of the Council, Meriden Peachy, the Director of Public Health for West Berkshire, Berkshire West, I must get that right, which includes West Berkshire, this district. Andy Sharp, the Council's Executive Director for the People Directorate, Matt Pearce, the Council Service Director for Communities and Wellbeing, and Joe Reeves, who is the Locality Manager for the Berkshire West Clinical Commissioning Group. Mandip Bhikkhu from the Council's Communications team is also present to advise the board. Gordon Oliver is the clerk, and Kevin Griffin is the Zoom host for this meeting. I'm also very pleased to welcome Warwick Heskins from the West Berkshire Pub Company, who has kindly agreed to tell us about the preparations he has made for reopening his pubs when we get to item 4 on the agenda. So what I'm going to do now is ask Gordon Oliver to run through some standard reminders about the way that council meetings are conducted via Zoom.
Gordon, you're on mute.
I'm glad someone else said that.
Sorry, apologies. In addition to the points shown on the screen, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised a Zoom hand has spoken, anyone who has telephoned in will be invited to speak in order. Any voting will be done by a show of physical hands. And if we need to adjourn the meeting for any reason, then you'll be advised of the revised time and date of the meeting. If it's a short adjournment, you'll be able to rejoin this Zoom meeting. Otherwise, a fresh appointment will be sent out. Do members have any questions about the way in which this meeting will be run?
Right, so item 1 on our agenda is apologies. Gordon, do we have any apologies?
We have had apologies from Councillor Lynn Doherty and from Shiro's Claridge, and Joe Reeves is substituting for Shiro's. Thank you.
Members, you've had the meetings pack with the minutes of the meeting on the 29th of March, and I'm seeking that those are a true record. So before I come to proposing the minutes, are there any amendments that anyone wishes to raise? No. Well, I am happy to propose those from the chair. Does that find a seconder? Councillor Masters, thank you very much. All those in favour, traditional show of hands, physical hands in front of the screen. For those of you who were there, of course. Gordon, I hope that's satisfied you.
Yes.
And now, declarations of interest. So, Gordon, have we had any declarations of interest in advance?
Nothing in advance.
And are there any members who wish to give a declaration? Again, don't see any hands. So let us move swiftly on to item 4 on the agenda. And as we know, today I have already been in a pub garden. I have taken the opportunity to go in a pub garden straight away. And we know that there has been a further easing of lockdown restrictions from today, with outdoor space at pubs and shops, some gyms, hairdressers allowed to reopen. And as I said in the introduction, we have Warwick from West Berkshire Pub Company with us, who's kindly agreed to say a few things about the preparation he has made. So Warwick, if you'd like to unmute yourself in the tradition, it's over to you.
All right, thanks. I've just got to try and work out how I'm going to share my screen. Hold on. Well, there we are. Hold on. That. And that. Oh, you don't have to look at me. Hiya there. Well, first of all, I'd like to apologise for not being a hairdresser or anything like that, because I think that was what the idea was originally. It was going to be someone from another sector, because you had Andrew Mackenzie before in another meeting, and it's going to be a slightly different one. But apparently they're too busy snipping at the moment, so it's all quite busy. So I thought I'd just give you a rundown on a little bit of what the last few months have been to us in the industry, and also what's going to happen. So for me personally, I've got the spare wheel and the Catherine wheel. Spare wheel's going to be opening on Wednesday. There's no actual reason why we didn't open today. I just thought I'd let my team go out and have some fun for the first 2 days before it all goes back to work. So we've got some outside seating in the marketplace. We've got room for about 40 people. Catherine wheel, I still haven't decided on whether we're opening or not yet. I'll probably decide that next week, seeing how it goes. If we do open, I've probably got seating for about 20 people in the courtyard, on the back end of the courtyard. So that's a decision I still got to make. Over the last year, the statement of fact would be, I would not have survived without furlough or government grants. It's easy as that. There's no way everything that's happened over the last few months we could have survived. At my last count, I was about £5,000 worth of stock I've either thrown away or it's gone out of date. And I've literally thrown down the drain, following guidelines. Opening up again, it's difficult to work out you've got to look at your costs against the likely reduced sales. Obviously, you've got such a small customer base now, definitely with the outside seating. But unfortunately, the staff costs still remain high because you need someone to do track and tracing. You've got to do table service, so that's all quite high. And so basically, you always have to overstaff, and that'd be the same for me and the same for any pub, restaurant that's opening now. You have to overstaff. Just to kind of give you an idea, this is for my actual accounts from the last year or so after December. The blue line is my sales, and the red line is my staff costs. So obviously you can see a huge dip in the sales from when the lockdown began and down. But what you notice on the red line is the staff costs have been roughly about the same. So even though you've reduced the sales so much because of the restrictions, we're so much more staff costs because you've got the staff opening up and table service and etc. So it's very difficult. But on my bright side is I'm in a lot better position than all the others that haven't been able to open because they've got no outside seat. So I'm lucky for that. Sorry, what we've done. So it's just a few pictures to say roughly what we've kind of done. So obviously we've had a COVID secure risk assessment that we do every time we open. It sounds like a normal now. So every time we shut down, every time we reopen again, we have to do another risk assessment. So the last one's been updated for today. And then obviously we have to review it again for whatever date we end up in step 3. Hopefully it's May 17th, but maybe, who knows, but that's what we're aiming for. We've got a cleaning and sanitising process. That's the whole of the pub and restaurants, and this is the same for everyone. It has to be completely sanitised, and an ongoing 20-minute sanitising process. We've now got a COVID testing strategy for the staff. At the moment, I've applied for the government testing. I haven't had anything back yet. So at the moment, the strategy is to tell the staff to take their free 2 tests a week if they can. But obviously, that's a voluntary thing. So it's up to the staff to do. But then we've got a strategy for them to take it and let us know if they've take positive. Then they have to go to get a test if need be. Risk assessment for the outside seating area. Definitely, this is for the spare wheel, not the Catherine Mill. Obviously, we've got the outside seating in the middle. Because the decision was made to close the roads for the next 5 weeks, it's made it a slightly issue. I know Pizza Express have decided not to take up their option in the middle of the area because of the safety concerns. I've decided to mitigate it. But so it's difficult. So obviously the road, so basically every customer we got is going to be across the marketplace road. So we've got to put a strategy in place for the risk assessment, making sure it's safe for the staff to cross the road, take the drinks out, take the food out, collect drinks and come back. And obviously the same for their customers to go to the loo if they come back in. We've got staff training, which is an ongoing thing anyway, and a safety assessment, again, for the staff to make sure they know what they do. The new NHS track and trace posters, because everyone now has to check in rather than just one person in the group. So we've had to rechange that process, and hopefully people will understand that as they're coming in, because it was sometimes a bit of an issue, even with it one person. But now it's every person in the group has got to check in, so we'll see how that goes. I'm sure it'll be fine. Standard update COVID signage, one-way system. So we've got a one-way system, even the spare wheel, we've got one-way in, and it's out the same door, but kind of one-way system around the restaurant back out again. Got sanitizer stations at the entrance and outside the toilets. About to get a new GPS credit card terminal to take the payments outside rather than people coming inside to make the payments. So we've got the card terminal for that. And we're trialing a new order and pay at table app. So that's basically, that's really quick. That's really in a nutshell what we've had to do. Obviously, it's been kind of an ongoing since last July when we first opened. So, it's just, we keep adapting as the way we go. I spoke to a couple of other people who've been running other, I spoke to a hairdresser and a beauty parlour. They'd sat at the same kind of thing. They've obviously sanitised, and it's just a case of adapting and trying to make the best of where we are, really, and the scheme of things. But I think that's basically it for me. But it's really for you to kind of ask me if you've got any questions or anything you want to know about how we've changed things. I would say I've been out, just had a quick wander around today, just to a few other places, not in this council area. I popped into Reading, and I was quite surprised by some of the differences in what people class as outside areas and inside areas, and it seems to be a little bit of a fine line, but what's inside and what's outside. But I'm sure that'll all level itself out over the end. So, but yeah, so if you've got any questions, what you want to throw at me, that's the main thing is.
Indeed, and I'll come to members in a moment, but if I take chairman's privilege first, certainly a question I have for you is how you have found the guidance that's been issued by government. In preparation for this meeting, and indeed knowing that our local pub in our village had a marquee prior to this particular lockdown, and which was still up in, I drive past there quite often, I knew it was still up in the garden. I was intrigued, I wanted to check out the regulations. I had heard what the regulations were about marquees and how many sides and whether the sides were removed and so on and so forth. And I found it quite difficult to find the precise regulation or the precise guidance on the use of marquees in pub garden spaces, for example. So I'm just wondering how you found working your way through the guidance in order to work out how to open, what was safe to do, what you had to do, what you were required to do, and so on and so forth?
I asked the questions, basically. So from the government side of things, the government guidance is very thin. I suppose that's a fair word. So, but I've checked, and Sean's on here, so Sean's kindly held a couple of Zoom calls with all the licensees who attended and gave their interpretation of all the legislation. But I find it's kind of some things are kind of a grey area. The inside outside bit shouldn't be a grey area, because it's a class line. It's basically the same rules as what is a smoking area, what's not a smoking area within the pub. So it's a kind of 50% open sides. But it seems I just get slightly not annoyed, but slightly aggrieved. But sometimes you kind of go elsewhere, and if you're doing everything how you think you should be doing it, or how it's described, and you go outside and hold on, that's not really outside. How come they're getting away with it and I'm not getting away with it, or I'm not being able to do that? Just seems strange. But to be fair, the guidance is clear, and it's all been described, and it's absolutely fine. But it's just I think a lot of things is it's almost people burying their heads in the sand. If they don't know what the rules are, or they don't want to know what the rules are, they can get away with it. If you know what the rules are, you don't want to get away with it. But it's there's a fine line. But as I said, I've been somewhere today in Reading. I won't say where it is, but it was basically indoors. It was very much indoors. It's in the kind of a covered marquee, fences all the way around, and it was indoors. But
yeah, that, and I will bring Sean in when you've taken questions, in order to reflect on how he views things from the authorities' point of view, and how he sees the enforcement and various other bits and bobs, and what our approach is. But let me move to members. Councillor Stewart.
Thank you, and thank you, Warwick. That's really interesting. I live in the east of the district, so I've also been into Reading today, and I think I might know the place that you're talking about, because I've also seen lots of photos of friends that have also been sitting in what I class as indoors. So I can understand how it would be frustrating. I wish you every success in the next phases. I just wondered, I've managed teams of people, not in a retail or sort of hospitality setting, but how have you managed to keep your teams motivated during this sort of up and down, where they've been in, they've been out, they've been in, they've been out, all that sort of thing? Just interested to know really how you deal with that.
It is difficult, and depends. I've got what have we got at the moment? I've 13. So over the time, I've got 13 staff members. I've actually, since the original lockdown, I've kind of increased the staff, which is quite impressive, really, in the scheme of things. But no, it's just basically we've got WhatsApp chats, and everyone just chats to each other, and they're all doing their thing. I've got a couple of staff who've been volunteering at the Newbury Racecourse for the vaccination centre. A couple of others do another. One started as online jewelry business. So they're all doing their own kind of things, but we kind of keep it so everyone's in touch with everyone else. So it's basically it's almost like a big family, really. It's kind of everyone's just chatting to everyone else and just keeping them in. We do little bits of online training, so I've got some CBTs that we send out every now and then to keep them up to date with everything that's going on. Done a little bit of decorating as well, and building works on the new place. It's just basically just keeping them involved and letting them know what's going on, and it's involvement.
Yeah,
but it's just keeping them involved, so they don't just disappear and they've been off work for 6 months and they just disappear. It's just keeping them involved in exactly what's going on. That's basically that's all you can do, really.
Yeah, absolutely. Thank you.
Okay.
Councillor Masters.
Thank you, Chairman. Thank you, Warwick. Really important. I've got to say I'm looking forward to getting back in there. Are you rolling out is there any food on the menu?
Spare wheel's got the full menu. The cafe meal, the cafe meal, the other thing, as I said, the other thing that's keeping involved, I've kind of kept Deliveroo going.
Yeah.
So I've been doing the cafe meal. I've been doing pies on Deliveroo. The spare wheel started on Deliveroo just to kind of keep it going and keep the name out there. And actually, it's almost a bonus, because there'll be a lot of people who've been getting stuff on Deliveroo who didn't even know they were there, and it's kind of almost like advertising.
Yeah, I'm looking forward to another show.
And to be fair with Deliveroo taking 35% of everything you take, it needs to be, you need to get a little bit of benefit out of it, because there's no money in it.
Yeah,
it's like a hobby.
Yeah, just on the safety issues of the staff and customers crossing the marketplace.
Yeah.
Has that also the lack of closure, has that had an impact on the number of covers tables that you can have out?
It hasn't impacted the number of tables as such. I suppose we've still could have the same number of tables as we originally licensed for when we applied for the license last year. It's just the convenience of it. I know personally, I think it is a shame that it wasn't done, because I think it'd have been such a good atmosphere in that marketplace if it was one big loads of tables all the way. Yeah. As I said, Pizza Express won't do it because they're a chain. They've got a strict thing about you not being able to cross the road, so they haven't been able to put their stuff out. But I just think the marketplace cries out to be, which I think probably from the Hemingway report will probably come out as that, but just trying out to be kind of just a pedestrianised, a nice continental feel plaza, really.
Excellent.
But and hopefully, even with the cars going through, it's still going to have that feel, and I think it'd be nice. And I'm hoping that everyone having the tables out there this summer will make it something that will hopefully impact and kind of change people's ideas of what can be done going forward. Because it should be. It's a lovely space. It really is a beautiful space.
It is. Thank you.
It's really nice.
Very best of luck, Warwick, and I'm pretty sure I'll see you in there.
Yes.
Yeah. Few days.
So, members, if there are no other questions, Warwick, if you'd like to, because you may have something to contribute when Sean speaks anyway, and you are, once we finish this item, you are very welcome to stay for the rest of the meeting, but you're also very welcome to leave and go about your business. So let me now move to Sean. Sean, would you like to say something on this particular subject?
Yes, thank you, Chair. So, I mean, as Warwick said, actually, the concept has been around for some time now in terms of what's regarded as outdoors, and it is the very definition that fits around smoking areas that go back to 2007, so 14 years that's been in place. It is the issue at the moment. It is one of the issues certainly this time round. There have been some other changes, as Warwick has alluded to, around things like booking in for individuals, around testing that's now available and everything else. But this is one of the areas where obviously we will be looking around compliance issues on the indoor-outdoor question. What I would say is that our starting point is to provide advice, as Warwick has alluded to, and if people want advice, we're more than happy to go out there and have a look, but we will be carrying out some checks, not just on that aspect, but all aspects of the compliance regime and the guidance that has been set aside, not just for hospitality, but for all of the sectors as well, Chair.
And do you have anything particularly on, what I'd be particularly interested in is how you see enforcement locally and how you're interacting with the other authorities within the PPP, the Public Protection Partnership, and how you see it working in our sister authority, and I'm particularly going to think of Reading here.
Yeah, so what I would say is that there is actually liaison goes on between authorities. So the tier 1 authorities across the southeast, there is liaison work going on, basically about interpretation and understanding around that. We also get guidance from the Office of Product Safety, who are the government body that basically are overseeing the guidance on these regulations. And that comes through on a fairly regular basis, along with online briefings for those that are involved in enforcement. There shouldn't be disparity between authorities. As Warwick said, the rules are, I think, relatively clear. I can understand what you're saying about the guidance, Chair, but the rules are the rules. And where issues like that come up, then obviously, basically, if we became aware of them in another authority's areas, we would pick them up with that appropriate authority.
Thank you. Members, do you have any questions for Sean? No one's leaping with their hand up, so thank you, Sean, and thank you, Warwick, again. Let us move on. Then item 5 on the agenda tonight is the vaccination programme update. And this is going to be well, I don't know how much of a double act, but a possible double act between Joe Reeves, who, as I said, is the locality manager for Berkshire West CCG, and Meriden Peachy, who is the Director of Public Health, Berkshire West. Now, I think Joe's going to talk about rollout and Meriden's going to talk about latest advice on vaccines. So I'll start with Joe, I think.
Thank you, and thank you for having me. I will just bring up my slides that have very kindly been prepared for me by a colleague at the CCG.
Hang on, so you're not taking you're not only not taking any credit, you're not going to suffer for these being incorrect, are you, Joe?
I will gladly take away any queries, Graham.
Sorry, Councillor Masters, is that a hand or?
That's a hand in anticipation.
Oh, righty ho. We'll wait to get to the end of this.
Yeah. I have a general question.
Thank you. So as the Chairman's mentioned, I cover all of West Berkshire, but if at any point I sound especially biased, that's because I've been very hands-on with the Newbury Racecourse Centre, involved in some of the operational management, so do forgive me. But I'll run through some of the data as well as key updates. And it's about a week out of date already, so where I can fill in gaps, I will. It's also relevant to note that patients from 3 practices are not picked up in the data report because of the clinical system the practice uses. So there are a few patients missing. I think we do get coverage of about 90% of West Berkshire residents from this report, though. So it's largely correct. So to start you off with some headlines, over 64,000 people have received at least their first dose in the West Berkshire area. Both the Pangbourne Hub and the Newbury Racecourse Hub have now offered a first dose to all patients aged over 50 or over 16 if clinically vulnerable. Pangbourne has delivered over 13,000 first doses. Newbury Racecourse has delivered over 33,000 first doses, and both sites are now on to second doses, with Pangbourne having delivered around 4,000 according to what the practice manager told me today, and Newbury Racecourse just behind at about 3,500 second doses. So both getting on well, and the discrepancy there, even though Newbury Racecourse is the larger site, is because they started in a later phase of the rollout of the vaccination programme. So looking at it by age cohort, take-up in West Berkshire is higher than average across Buckinghamshire, Oxfordshire and Berkshire West across all eligible age groups. And I think it's worth noting it's far higher than we see for the yearly flu vaccination programme. So really pleased with the take-up we're seeing so far. And in terms of inequalities by ethnic group, we do see some variance, but I'm quite pleased to say that this slide from the latest report is much better than the board will have seen about a month ago when my colleague presented. But there's many reasons why take-up is variable across ethnic groups. One might be the spread of misinformation among some of the communities. We've seen throughout the pandemic exacerbation of existing health inequalities. There are access issues, both in terms of access to a physical location, but also in terms of understanding the invitation, whether due to language barriers or disabilities. And also there's an awareness of how to work within the health and social care system that might affect ethnically diverse communities more than their white counterparts. So while there is variable take-up, it is really encouraging to see green across the board now, especially comparing this table to last time, which I can do here. So you would have seen the bottom table last time, which does not look as much the happy sea of green that we see now. And it's interesting that even from the data produced about a fortnight ago, there's been quite a rapid change as well. So last time, particularly around the Pakistani community, there appeared to be much lower take-up, which now is looking much better. So there are a few things that this could be the result of. One might be the work of the community advocates and leaders in our local area who have been working really hard within their communities and alongside the NHS and the local authority to promote vaccine take-up. There's been a massive focus on inequalities, and we might be seeing our efforts paying off. But I think as well, we're probably seeing a younger cohort in some of these particular ethnic groups. So for example, with the Pakistani community, this asterisk means that there were fewer than 10 people in that cohort. So because the vaccination programme only opened up to the over 50s more recently, that might be why we're seeing a bit of that lag. But regardless of the apparent success that we're seeing at the moment, there is still a lot of work being undertaken to understand decliners. So that would be those who make that active decision to refuse to take up a vaccine. So we need to think about how we sort of change hearts and minds there. So alongside local authority, there's a lot of work to look at employing health and wellbeing ambassadors to work directly with seldom heard communities to be able to address misinformation and concerns. There's also work going on to consider those who haven't declined or accepted. It's more sort of passive at the moment. So a lot of work is being undertaken to make vaccine access more convenient, so such as through pop-up clinics. The surgeries at the racecourse, because there are 9 of them covering quite a large geographic area, are quite keen to run pop-up clinics in the first instance back at their practice to see whether that helps kind of familiar faces, familiar location, shorter distance travel, and making it more convenient. And once that's done, they're looking at running pop-up clinics elsewhere in the community to see if that can further increase take-up. So for example, one of the local surgeries has already reached out to the West Berkshire Muslim Centre to explore the option of a pop-up clinic following identifying the data of take-up in the Pakistani community being lower. I'll go back to this one. So in the at-risk groups, things are also looking pretty positive, doing well in the older age groups still, and there's some catching up to do in the younger groups, but I think overall it's an encouraging picture. And then by deprivation as well, there's a marginally lower take-up in the younger age groups in deprived wards, but I think it's broadly in line, and I think overall it's still pretty good. So other things to mention, there's been a recent change to the existing Joint Committee of Vaccination and Immunisation cohorts. So household members of severely immunosuppressed patients now fall within cohort 6. So local vaccination services run by GPs will need to run some additional first dose clinics to mop up those patients, although many will have already been done because they will have been eligible themselves. And that decision was taken because those with severe immunosuppression are more likely to suffer poor outcomes following infection and are less likely to benefit from vaccines. So by vaccinating household members, you can hopefully reduce risk of transmission to those vulnerable patients. So I think that's all I wanted to cover. So shall I take questions and then hand over to Meriden?
Yeah, thank you, Jo. I'm going to take chairman's privilege before I come to Councillor Masters and Councillor Burke. Two things, but let me start with the numbers. Can you go back to the couple of pages back, the chart that shows yes, well, this will do, because I mean, this isn't particularly an ethnicity question, but it's a question on age groups within cohort 6. So I asked Andy a question this morning on this particular table, which was about what we were looking at. My understanding is that what we're looking at, if we look right across the piece on those age groups below 50, is those individuals within those age bands who are within cohort 6. So these are people who are eligible to be vaccinated now, aren't part of a future vaccination program which picks up younger people. Now, if you then go to the table that showed the 18 plus in particular groups of vulnerability, yep, that's the one, I think. Yes. So let's take the 18 to 19-year-olds. Yeah, we've got 90, 77 and 60%. So averaging out at some relatively high, a number certainly above 60, since the lowest there is 60. Question, who else is in cohort 6 that aren't on this page, and therefore they're the people who aren't getting vaccinated?
I suppose some could be health and social care staff, as they fall within cohort 2. So they could
No,
be...
sorry, I know that we've done pretty well on getting our social care staff vaccinated, but when you look at the overall picture, it's looking about 25% of 18 to, you've got, look, if we go across, and this is fairly small on my screen, so I'm having to lean in to read it, 22%, 25%, 19%, they're in the sort of 20 odd percentage points here. And yet, if you look at that other chart, it's 60% plus. So there must be a number of people of that age group who are in cohort 6 and therefore eligible and therefore appear in your numbers. I'm just wondering how they come into cohort 6 if they're not on there.
I'll check, but I think that this graph is looking at population.
You see, that's the question I asked. The question I asked this morning was, am I looking at the number of people eligible to be vaccinated who have taken up the offer? Or am I looking at the proportion of the population, some of whom may not yet be coming forward for vaccination, certainly in the younger age groups, who have been vaccinated? So can we just bottom that one out for another time? And my other question is about your white other column, because certainly an issue, a point came up at a meeting of the governors of Royal Berks the other day and it was about the take up of vaccination by, this was really by the BAMER community, but it came up that they have a lot of staff who are of a particular white European, if I can, I don't want to be too definition here, white European definition within the hospital staff and there appears to be a reluctance amongst that group to take the vaccination. And I wonder how we're addressing, I know that we're doing a lot to address BAMER community, but what are we doing to address white Europeans who are not getting vaccinated?
I'm happy to take that away and discuss that at the inequalities group and get you an answer.
Thank you. We'll come back to that then. Councillor Masters.
Thank you, Chair. Thank you, Joe. I've got a couple of questions. One's a specific question that's been raised by a number of people across the district in terms of their second vaccinations. Some people have had calls to cancel that their second vaccination has been cancelled and then to rebook. Is this, and they were a little bit confused. Most of them, I think, have managed to get bookings again. Is that something that was systemic, or was it? Do you know anything about the
I'm happy to answer that. So essentially, where that has come from is when the first round of appointments was being booked back in January, the guidance that the second dose would now follow at 12 weeks rather than 3, as it was in December, had just been announced. However, surgeries did not yet have a delivery schedule for the second dose. So many surgeries, trying to be efficient and save time in January, offered appointments 12 weeks on, assuming same day of the week, same time, to most of their patients. Yeah. However, as we've gone on down the vaccination programme, those deliveries are now happening at 11 weeks. And that's in that week contingency in case for any reason someone's not very well or can't make that appointment. So it has caused quite a lot of effort for the admin teams at the surgeries to rebook those appointments, and also to, it's caused a lot of confusion, which is really unfortunate. And but there is still a second dose vaccine available to every single person who had their first dose. It just is hopefully going to be earlier than expected.
Yeah, no, that's fine. People were just, as you say, there was an element of confusion and people were unsure as to what the rationale. So I just, I had a number of inquiries, so I said I would ask the question tonight. And secondly, not wanting to follow too closely into Councillor Bridgman's forensic analysis of your stat. They're not stated or refused in terms of the other ethnic groups. How do we, at what point are the people who have been vaccinated asked the question about their ethnicity, or is it going on their practice records? Because I know, having spoken to a number of community leaders, don't do that. Don't do that.
Why not?
The reluctance, is maybe based on trust issues or and things like that. But they're very keen to say that the community are very much behind getting vaccinated, and I do think it was really important that you highlighted, particularly with the Pakistani community and the Bangladesh community, where the cohort is. I think stats are quite striking that the 90% of the population are under the age of 40. So that is going to skew the figures quite dramatically. So the communities that have been speaking to myself are telling me that they are very much promoting vaccination, and the feedback that they're getting is that their communities are very keen to do that. So, they don't want to necessarily be isolated as a particularly reluctant. I do think that there may well be some issues, as Councillor Bridgman has mentioned, in the white European, because some of the things I've been seeing on social media are very much targeted to those communities in terms of anti-vaxxing and stuff like that. So again, thank you for what you're doing. I just wondered what you would like to say about the not stated or refused.
Yeah, sure. So data quality is always a bugbear with these sorts of things. There are two routes to gather information on the ethnicity of the patients. One is through the GP clinical system, and there has been a lot of work over the last year to ensure better recording of a patient's ethnicity, purely so that health services can be planned better for the population, not for any other reason, but to better understand the population and their health needs. Patients are, or they should be, asked by the vaccinator who administers the vaccine to provide their ethnicity. It may be that that's not being done in all cases, and that needs a reminder to the staff. And again, that is purely to help us understand and address inequalities in take-up among different ethnic groups in our ethnically diverse communities. So yeah, I completely hear what you're saying about a lot of support for the vaccination programme among community and faith leaders. I think that's recognised, and I think we are seeing a lot of the benefits of that being borne out in the data. I think there is still big gaps there, though. We are looking at 20% in some cases between some ethnic groups and their white counterparts in the same age group, which I still think, even though it's green, still needs some work to unpick. It might be that when I come back in a fortnight's time, everything is bold green, but I think that needs some further unpicking and understanding, and seeing what we can do to change the relationship between those patients and the health system.
Yeah, thank you. Just a final point, the Riverside pop-up, there's been much talk of that, and I know the community are very much on board with that. Have you got a timeline for when that will be fully online?
No, not yet. So in the first instance, practice manager has reached out directly and let them know when we're holding another clinic at the racecourse, just in case there's anybody else who could be ushered to come to us. And then after that, we'll see where we are and what expected take up would be from a pop-up at the Riverside. We need to book appointments rather than have drop-in in order to reduce any risk of vaccine wastage. So I'll keep this board informed of any firm plans as they arise.
Thank you very much, Jo.
Apologies, Councillor Bowick. I decided to mute myself and then decided not to unmute myself before I called you to speak. So, Councillor Bowick.
Thank you, Chairman, and thank you, Jo. Jo, you mentioned at the top of your presentation that there are 3 practices whose figures are not reflected in the overall data. What potential is there for us to see possible outliers, either in a particular MSOA or indeed in a particular ethnic grouping? Because 3 practices could represent an awful lot of people, a high proportion of a particular MSOA or ethnic group.
Yeah, so the 3 surgeries omitted from this data report include Mortimer, Hungerford and Lambourne. So I think the Hungerford-Lambourne is a bit concerning because that is quite a big geographic chunk. I think what we can look at is the Kintbury profile, because it's a broadly similarly large catchment with a rural population. So I think we can make some assumptions, but I agree we do need more granular data for all our surgeries to truly understand what we're looking at. And for Mortimer, likewise, sort of a similar-ish profile to Beale, to Pangbourne. I wouldn't dare tell Graham what Mortimer is like though, so I won't continue. But I think we can make some assumptions. But yes, I agree, more detail is needed. I think one thing that's been raised is whether the racing community have got the same level of access to vaccinations, so largely congregated around the Lambourne area due to the nature of their work. Turning up to Newbury Town Centre at midday on a weekday is probably not ideal. So I think that's one area that has been raised as potentially needing some more focus and more convenient access to the vaccination programme. Thank you.
I have just one more question for understanding. So what is the data that is missing? Is it the data on vaccinations delivered at the surgery, or is it data on patients registered at the surgery wherever they received their vaccination?
The latter.
Thank you.
Well, you can take it that there are 2 from Mortimer that got vaccinated. You know, I'll just add that into the numbers. Okay.
Thank you for that, Chairman.
Councillor Stewart.
Thank you, Chairman. Actually, it's probably a carry-on from Councillor Bowick's question, because as I said earlier, I live in the east, so I'm at Calcott Tilehurst. So I'm not registered with a West Berks GP because, to be honest, there isn't one anywhere near, which means that all of my vaccination and probably the majority of my residents in the ward and in neighbouring wards will have gone to Reading. And will have used things like the Tilehurst Triangle Pharmacy, who've been excellent, and other provisions in Reading. We also have, and just sort of tying that up with one of your slides about deprivation, we have quite a number of areas within the Tilehurst and Holybrook and Calcott areas that are also classed as high deprivation. So it's, and I understand, you know, data it can be the best thing in the world and the worst thing in the world when you're trying to get all of it together. But it certainly, from my perspective, there is a chunk here that potentially is missing, and actually is not painting the really even more positive picture than you have. And I don't know whether there's any way to fix that. Certainly, perhaps Councillor Bridgman, in his new role of in terms of health and integrated services, etc., may be able to help address it. But yeah, it was just an observation, really, that there is something that, as you said, that is missing there. And then also, I just had a question about the AstraZeneca, and whether you are hearing that people are reluctant to come forward because of the unfortunate press that there has been about that particular vaccination. Certainly, I'd just like to say I've had my first AstraZeneca jab and absolutely fine, apart from a bit of a dead arm. So I've got no concerns about it at all. But I just wondered if you're hearing that people are reluctant to come forward for that reason.
Thank you, Jo. So on the first, I completely understand where you're coming from. There is a data report published weekly on the NHS England website, which splits out vaccination events across either local authority area or I think MSOA and constituency, as well as LSOA. So if you did want to look at a West Berkshire residents rather than patients registered at West Berkshire surgeries, then that can be done on that site. This data is compiled directly from the practice systems we have access to, because that's kind of the best proxy for where is that patient located. Mm-hmm. But I completely understand we've got that eastern urban area where it's quite melded. So kind of there's a lot of cross-border sort of kind of travel and services there. So you're right. I think I'll see if there are any plans to be able to get this more as a West Berkshire local authority boundary perspective rather than those surgeries located in the West Berkshire area.
Thank you.
In respect to your second question, not at the moment.
Good.
There have been a couple of queries via the Vaccination Centre's Facebook page saying, should I have my second jab? Or, I'm worried about this one. But I can count on one hand the number of queries at the moment. So I think that might be a timely point to hand over to Meriden to cover off.
Indeed, I was going to say that. Thank you, Jo. Before we do hand over to Meriden, just to bottom out that numbers piece, if we can get to a point where we understand the percentages of people who are eligible for vaccination and have or haven't taken it up, I think that's the telling number. That's really what I would like to see us get to. Who is refusing or who is just not responding to advances. And I guess that information, because this is pretty much cohort 6, that information is with the GP surgeries, because they're the people who sort out who is eligible and who isn't based on their patient record, I'm assuming, from our previous conversations on this. And I see you nodding, so let's move on. Meriden.
Sure, thank you, Councillor Bridgman. Yes, there has been some slight changes to the vaccine. I think people will have heard, particularly across Europe, there were concerns about potential blood clots with low platelets following the AstraZeneca vaccine, and with various countries making different decisions. The MHRA, one thing we do know is they have an extremely good system of recording every single adverse event following a vaccine. So we have a pretty good systematic data in place. And MHRA and also the European medicines regulators have also been reviewing the potential of blood clots being a side effect. And they have come to the conclusion that firstly, it's very rare. It's a rare natural occurrence for some people to get these blood clots in the population. But secondly, there seems to be a very slight increase following the A to Z vaccine, which is not necessarily the case with the Pfizer or the Moderna vaccine. So the conclusion is from the MHRA that it is still safer to have the vaccine than not. And what they've done is they've weighed up the risks versus the benefits. So the only reason they've come up with a suggestion that the under 30s should probably, if they can, have an alternative vaccine is they're at a lot less risk from actually getting COVID anyway. So their risks are lower. And it's more of a precaution than an actual definite these are highest side effects. And we're talking about something like 4 per million events following vaccines of this of blood clots. So it is rare, and the MHRA are basically saying it is fundamentally safe having the AstraZeneca vaccine. I mean, in terms of making this slight change, they've also said that there's unlikely to be any change in the target for all adults to be vaccinated by the middle of July. And there are alternatives. The Moderna vaccine actually will be available to us from next week. And we're still we're waiting for the go-ahead to start vaccinating categories 10 to 12. So there's all the focus is still on categories 1 to 9. As you've seen from the data in our patch, there's very few that are actually not vaccinated. So it's actually quite hard now to getting those last few to come forward. So I think the message is to professionals, and they have new guidance that's gone out, is to weigh up the risks of individuals. And if anybody's had a blood clot in the past, obviously that would affect the decision on which vaccine to have. And at the moment, I think anyone who'd been booked to have a vaccine if they're under 30 has been cancelled, and to have a discussion with a clinician.
Yes, I think I reflected that if I'd got any box of tablets from anywhere and opened it and got the instruction sheet and actually read every possible contraindication and everything that might happen to me as a result of taking aspirin or paracetamol or whatever, you know, you'd never take another drug in your life. And, you know, not that I particularly take drugs, but there you go. Right, Councillor Vickers, you seem to be back with us. That's really good. Let's see if we can hear you as well.
I hope it lasts. Sorry, I've been in and out, and it's been a really interesting discussions, the bits that I've heard. So I do apologise for for losing you all. Yeah, I mean, I was really, I suppose it's a similar point to Councillor Bridgman's I was going to be making, is how can we help people to understand risk? Because some simple examples about risk, because it's just what Councillor Bridgman has just said. If you read the tiny print on the tablet you take over the counter, you wouldn't take anything. So I've heard, was there a sort of a comparison between if you take a long haul flight or if you go on a plane or something, you know, the risk you're taking by taking that flight is more than if you get the AstraZeneca jab. You know, there's some very basic things. So I'm just wondering whether there's simple examples we could be putting out there to help people to get all this in proportion, because the media has just blown it all up, as they tend to do, thinking they're informing us, but in fact they're misinforming us by blowing it all up out of proportion. And it is quite worrying that people are just think there's a risk when it's such a tiny, weeny risk. So it's just thoughts about how we get the understanding of risk across.
You've made a really good point, is to help people understand the risk of, you're right, whether it be flying or taking other drugs. There are some other drugs that give a very small risk of blood clots too. And interestingly, there are some of the flu strains where there's a very small risk as well. And one of the flu vaccines, it's same thing, a very rare risk. And I think they've also seen these blood clots post-Ebola as well. And it's also a known complication of actually having COVID. So there's more of a risk in having COVID than there is of having the vaccine, which is where the risks and benefits come in. But you're right, and I think that point has been made, and I think we're waiting for MHRA to come out or DHSE to come out with some further guidance on that, so people can see balance of risks across a number of different things. So it's a really good point. But I think I'm more likely to suggest that we wait for the experts to come up with that for us, rather than us coming up with some of our own.
Thank you, Meriden. I don't see any hands, so we'll move on to the first and second parts of the Matt Pierce show. So, Matt, we have COVID-19 situational report. Over to you. Item 6 on the agenda. It's a verbal update.
Sorry, just share my screen. Thank you, Chair. I've actually only pulled together 4 or 5 slides this evening, and conscious of time and given the improving picture, I just thought I'll cover this quite briefly tonight, if that's okay. So a slide you're all familiar with, the overall situational awareness. So we have our local authorities on the left-hand side. The individuals tested, percentage of individuals testing positive, cases per 100,000 of all ages, and cases per 100,000 60 plus. Throughout the epidemic so far, we've had 6,325 confirmed cases, and in the last 7 days, 23 cases. If you have a look in terms of our positivity rate in West Berkshire, just hovering over here, is about 0.8%. So that's the proportion of individuals that are tested. 0.8% of those are testing positive. So we've had quite a big decrease in that rate now. Equally, when you look at the cases per 100,000, we're now the lowest in Berkshire. So we have 14.5%, which is also lower than the Southeast average of 17.7 and the England average of 29.3. So certainly going in the right direction. And then when you look to the cases per 100,000 for 60 plus, again, we're at 2.5%. So the second lowest next to Bracknell Forest have got really good.
I'm sorry to interrupt you, Matt, but I'm sure
Yes.
you don't mean percent.
Oh, sorry, was I rates per 100,000? Apologies.
I get worried if we were at 14.5%.
Yeah, no, apologies. 14.5 per 100,000. Thank you for correcting me, Chair. And then, yeah, per 100,000 for 60 plus is 2.5%. That's 2.5. Get out that habit. So again, that's really good, because I think there's some indications now that the vaccinations are having an impact on that age group. And as we know, that age group is most vulnerable. In terms of the ward breakdown, I'm not going to go into this in too much detail. Numbers are now quite low that we have to round the data to the nearest 5. So this just indicates a few of our wards where there may have been clusters or an outbreak as such. And that's really where the wards are showing a few more cases than the others. Some cases that have 1 or 2, they've been rounded down, so we don't actually reflect those. So that's just really an indication of an improving picture. And if you think back maybe a few months ago, most of these wards had quite a high number of cases in each of them. And then sadly to the deaths, obviously there's been 247 COVID-19 related deaths during the pandemic. 1 death was recorded in the latest week data we had from the 20th to 26th of March. And our all-cause mortality rate is 18% higher than the previous 5-year, which equates to 234 additional deaths. So I said all-cause mortality rate really is the gold standard for us to assess the impact in terms of deaths. But as we talked about a couple of weeks ago, obviously we know that long COVID is a challenge, and that affects quite a high number of our cases as well. So something we need to think about going forward. In terms of the hospital activity, again, the decrease in rates reflects the improving picture in hospitals. The number of admissions for COVID-19 patients in Royal Berkshire Foundation Trust remains low and continues to do so. And again, this data is slightly dated, but on the 30th of March, 14 patients were in RBHFT hospital for COVID-19, and 3 of these were on mechanical ventilation. That number's likely been reduced since. So again, there's a reflection of the impact of the vaccinations having in terms of hospital admissions. We've covered vaccinations. So that's what I was going to share, Chair, in terms of the surveillance update.
Okay. Anyone want to ask a question? I see no. Good. Move on to local outbreak control plan. Now, we had this at the last meeting. Sorry, Councillor Vickers, you put your hand up. You're muted, Councillor Vickers.
Sorry, I probably should have brought this up earlier. I don't know whether it's a question possibly for Sean, but I just thought I'd just throw it in now. I had somebody asking me, or I've been hearing that hairdressers are testing people or asking people to do a lateral flow test before they go. Is this a requirement, or is this just individual businesses are thinking of doing this? I mean, what is the situation about asking people to test the general population? Are we encouraging them to be testing themselves, whatever, every few days?
I'll let Matt first and then Sean.
Yeah, I'm happy to pick that one up, Councillor Vickers. As yet, there's no requirement for people to test. and establishments shouldn't be asking people to test. So there's no requirement, as far as I understand, to do that. Obviously, what we're trying to encourage is the local authorities to get people to test themselves twice weekly. That's now available for people of all ages, if they so choose to get access to lateral flow tests. So what we're trying to do is encourage people to do that, but there's certainly no legal requirement for people to take a test prior to entering any of these settings. I don't know if Sean has a different view, but that's my understanding.
No, there's no legal requirement. I mean, what we are doing, though, is, as Mark suggested, obviously encouraging the public, but also encouraging testing in workplaces as well. But there's no requirement for people to have a test.
So if a hairdresser is doing this, they're just probably taking it upon themselves to do that. It's not really, shouldn't be necessary. Yeah. Okay, thank you.
And I think I'd just add that I signed off a press release that went out very recently about the community availability of LFT testing, so that there's a whole load of stuff on the website, and anyone if they go onto the West Berks website and look up lateral flow testing, they will find a lot of information and how they can get hold of test kits in order to do as Matt has said. Let me take Meriden next.
I was just going to say, I mean, Matt's absolutely right. I don't think businesses can require people to have it, but we do encourage people twice a week. But there's no reason why hairdressers and businesses can't encourage people to get tests, because I'm certainly getting a lot of feedback that people are finding it difficult to do it twice a week, or they're not really coming forward. And we've seen a drop off in people coming to our community testing sites. So there's no reason why businesses can't encourage or even be handing out information for us, but they certainly shouldn't be requiring it. And we found out just today that in West Berkshire alone, there are at least 19 pharmacies that are offering community collect. So people will be able to go on the national website and just to find their nearest site, put in their postcode, and they'll be able to get community collect. So they'll be able to pick up boxes of tests for them to do at home.
Thank you. Councillor Masters.
Thank you, Chairman. Matt, just a quick question. You refer to the number of patients that are in Basing in RBH. With the proximity of Basingstoke and even indeed Great Western, do we have any data on admissions of people who are, maybe from West Berkshire that are in those?
I don't have it to hand, Councillor Masters, but my view is, and I think this is a recurring picture across the South East, is that admissions are generally going down across the board. But I'm happy to get that data for you and share that with you.
Thank you.
Councillor Stewart.
I was just going to, thank you, Chairman. I was just going to add to what Meriden was saying, actually. I applied for on the government website for a testing home kit on Saturday, and it was here with me this morning. So I was very chuffed with that service. So yes, you don't even need to set foot outside of your house to get a testing kit. Thank you.
But we are shipping them around the district. I'm going to plug that one, because otherwise our van drives are driving around and no one's picking them up off them. So,
I thought it was you for it. You're not driving it.
Well, yeah, that service is available. Thank you. Right, no other questions on that. So let's move on to the outbreak control plan, Matt. And indeed, as I say, we mentioned this last meeting, I think, and at that point we were waiting for Public Health England to approve our plan, and I think they have. Over to you.
Thank you, Chair. So it's a little bit longer presentation, but I'm conscious of time, but I'll go through this as quickly as I can. What I will do is, obviously, a few of you might recall that we actually published our plan back in June 2020. And so this is really an update of that plan, thinking about the learning of what we've experienced over the last few months and how we can improve that plan going forward. I just wanted to give an overview in terms of where we are. So when we first published a plan, we actually included the first 4 boxes of this plan. So when we published it, we were in a control and recover phase. At that point, there is a possibility of a second wave in terms of what we viewed then and further national restrictions. And obviously, lo and behold, that was the case in December and obviously the early part of this year. And then our anticipation then was going into a phase 4, which would be looking at prevention and renew, where the view was that vaccines or treatment would potentially become available. And obviously we now know that they have come available at an incredible pace. So really we're now moving into what I've called phased 4B, if you like, which is from March onwards, and very much looking at the government roadmap, which I've called Living with COVID. And obviously we are, as of today, just moving into step 2, where a host of restrictions are being lifted. So it just gives you a bit of an idea in terms of the journey that we've had over the last 12 months or so. So as I said, local authorities had a duty to produce a local outbreak control plan. Ours was published first in 2020. What we do know is as the population is vaccinated, levels of immunity in the population will rise and prevalence declines. We expect to be dealing with more localized outbreaks that require decisive local-led action. So very much at the beginning of the pandemic, we all know that a lot of the coordination is done at a national level, but increasingly so, more and more work will be done at that local level. So really what our update plan covers is the learning of the past 9 months. It outlines plans for the next phase and the potential changes in roles and responsibilities. So why do we need a local outbreak control plan? As I said, the challenge we have is as more businesses go back to business as usual, as the local authority goes back into business as usual, we need to ensure that we have a plan that maintains our response on a sustainable footing, responding to those localized outbreaks as needed, ensuring we reduce vaccine hesitancy and so forth. And really the 4 principles outlined in our plan to enable our communities to live safely is that we want transmission of the virus to be brought and kept as low as possible. It's really important we look at surveillance of the transmission, and the variant emergence must be optimal. So again, if we identify any variants within the local authority and across the district, we act swiftly. And test, trace and isolate needs to work effectively with a clear testing strategy. So we've already talked a lot about that, but even more so, we know that test, trace and isolate works most effectively when rates are really low. So it's a really good opportunity to make sure we have everything in place we can do to ensure those rates stay as low as possible. And then clearly vaccines, they need to be effective and delivered equitably, again, which we've already covered. So the key themes in our plan, I've changed these slightly. There were 8 originally. I just want to highlight the ones that I've identified that really our plan focuses on. We talked about testing, but the variants of concern are a particular request from the government as part of our plan. So as we know in Europe, when prevalence is high, there is a risk of more variants of concern emerging. If we do identify variants of concern, then we need to ensure we put in place a plan very quickly to isolate those individuals, do case finding. Also, since our plan's been published, we've created a new local contact tracing partnership, which is headed up by Sean on this meeting today. So again, it's very much about how we utilise our local intelligence, our local resources to identify those individuals that can't be contacted by the national team, but also to look at the history of those cases so we could identify where they might have been and where there's patterns in the data to identify hotspots, so to speak. Community engagement continues to be really important, and again, that's an area that we've done a lot of work on over the last few months, but working with our partners and also community champions, and again, looking at vaccine hesitancy. And then number 7, compliance and enforcement. So increasingly important, as we've just talked about, in terms of as the restrictions are lifted, how we can support our communities to do this in a way that is compliant. And as a last resort, obviously, we will look to utilise our local powers as needed. And then vaccinations, which we've covered. And then finally, enduring transmission. And what I mean by enduring transmission is really areas of the country where they have sustained prevalence of COVID, which is higher than the national average. That's not really occurred as such in West Berkshire, but there's no reason why it couldn't in the future. So we just need to make sure we have a plan in place to understand how we would act in case there was enduring transmission across the district. So I'm not going to go to this slide in too much detail. I think the key thing that has changed is the emerging evidence in terms of managing risks around airborne transmission. So as we know, originally at the beginning of the pandemic, they were much talking about larger respiratory droplets, but now they know that actually smaller aerosols can play a key part in transmission, which is why things like face coverings are really important now. And obviously ventilation is one of the key messages the government's pushing out in terms of how we can prevent people from getting COVID. And then just as we realised back in June, we know that some people are more at risk and need extra protection from COVID, whether it's older people, people with long-term conditions, and individuals from ethnic diverse communities. So throughout the pandemic, the local authority and our partners, NHS, we've worked really hard and we identified all these high risk settings at the beginning, in June of last year. And we've continued to work closely with all these settings when they've had positive cases, whether they've had outbreaks, and we have individual plans for all these settings to know exactly what our response is if there is a confirmed case, and that support is either offered by Public Health England or by the local authority. We have identified some settings actually throughout the pandemic that weren't on our list, and we continue to do that mapping. So we do identify high risk settings that might need support and make sure they have prevention plans in place too. I'm not going to go in this in detail. This is the outbreak management process, which we've been following from the beginning. It just really shows the process in terms of where the information comes from, how we actually respond and what groups we put in place. The only thing I would probably point out is we now have a surveillance cell, which we didn't have in place back in June. And that really is the group that comes together to really review that data regularly, twice a week, involving Public Protection Partnership, Public Health England, Environmental Health, Public Health, to look at those hotspots, look at the epidemiology, and look at backward contact tracing as well to see where contacts and cases may have been. Hope I'm not going too quick for you all. In terms of responding to outbreaks and enduring transmissions, again, I think this hasn't really changed. We continue to look at the data. We encourage residents to hand wash, practice social distancing, and we put in place the necessary actions if we needed. And the actions are very much dependent on the risks identified in the specific situation, which is based on evidence. And those actions, again, we've put in place throughout the pandemic. Obviously, testing, closure of premises, restricted visiting in care homes, but it's really pleasing now that those are slowly being lifted, contact tracing. So I'm not going to go through them all, but there's a whole host of actions we can call upon if needed. And then enduring transmission, really, the actions that we would take on enduring transmission is just an elaboration of all that I've covered. It's just a whole host of things coming together, drawing on those resources that we need to reduce that cycle, but also to escalate as needed up through to the regional partners and groups to support that approach. Our community support hub continues to go live throughout the council and support people. The activity has reduced, and at some point we will take a decision about what we do with the community support hub. If we do stand it down, then we need to immediately stand it back up if we need it, if we need to. Communication with the public, I won't go into any more detail in that. We've got an update on communications soon, but again, we see that as being really important. Obviously, the local outbreak engagement board itself is that member-led board that's held in public, where the public can hear what we're doing. We've done lots of work on our websites, and obviously we have that Berkshire Public Health website as well, which is a rich resource of data and information that the public can access. And then the governance, I won't go into too much detail, that's not really changed. And then finally, contacts. Again, just wants to draw a couple of points really. We've just introduced an automated COVID-19 information line, so the public can just phone that number, the second from bottom there, to really just hear about the latest guidance, what they can and can't do. We recognise that there is some issues with digital literacy, and some people might just want to pick up the phone and hear about what the latest guidance says. So that's a new feature which we've recently added, but apart from that, there's a whole list of information there that people can find out more information and who to go to if there's a positive case, particularly within their workplace. Sorry, that was a whirlwind tour, Chair, but conscious of time. But that's all for me.
And for those who can handle the digital, that of course is on the website. So, Councillor Vickers.
Thank you very much, Matt. So, I mean, this is called Living with COVID, the section just been talking about. So we're looking quite long term here, aren't we? We're really looking at a sort of really heightened state of awareness for quite some time. And I'm just wondering whether the public possibly appreciate that sort of you'll never get back to the way things were before, because things like wearing masks and being aware of your hygiene, etc., should become part of our daily lives. And I compare us to Japan whenever we go and visit our sons in Japan. Mask wearing, hand washing, they get taught, schools, I think children get taught about hygiene and the importance of hygiene in schools. People always wear masks if they've got any worry about infection in a public place. So do you think that there's a way to go to try and sort of get people thinking about long-term future? Because I think people still generally think this is something that's going to just fade away and we can forget about it, you know, in a few months' time, or maybe at the end of the year or something.
Yeah, absolutely. I mean, firstly, I think we're not out of the woods yet, and I want to make that point. And I think that there's a high probability that Sage says there will be another wave at some point. So, you know, whilst the picture's certainly improving and really positive, I think, you know, there's still maybe another wave, that's likely. And then absolutely, I think everything you've just said, I think there's some good things we can hold on to. I mean, some things might not be required going forward, and obviously we await government guidance and evidence in terms of face coverings in particular about when you can and can't wear them going forward. But things are hand washing, absolutely. And, you know, we know there's been low prevalence of flu this year, you know, and that's probably been an impact because of social distancing and people staying at home. So I think, yeah, I think there's some really good things that we can encourage people to hold on to in terms of good hygiene practices like you just referred to.
Meriden. Muted.
Yeah. I mean, Councillor Vickers, you raised a very good point. The UK Health Security Agency that's been announced, which will be the replacement of Public Health England and joined by Security Centre and the Test and Trace, they've suggested that in the future there will be a significant role for local government in communicable disease outbreaks. So what we're setting up is something that is actually, I think, going to become part of the norm in the future. So it actually gives us a bigger role in talking to the public about their role in communicable disease, infectious diseases. Now, obviously environmental health have been doing some significant amount of that anyway, and have got the skills, but I think the Health Security Agency really want to build a much better relationship with local government and have a local system going forward. And they've already started to look at what that might look like.
Good. Thank you very much. Thank you.
Come back okay or something? See no more hands apart from Meriden still up. So thank you, members. Let's move on. Communications update. Mandip.
Yes, good evening. I'll make my update really quick because I'm conscious we are quite over time. So comms update for everybody is that we are obviously concentrating on step 2 of the roadmap to recovery at the moment, with the reopening of the non-essential shops, hospitality, etc., along with the hands, face space and fresh air messages. And then step 3 will also be communicated out in a few weeks' time as well. We've also been filming with some local businesses who are opening from this week, and we'll be able to share those over our usual comms channels over this week and next week. And the videos are about kind of their thoughts on reopening and how they have reopened and are going to be COVID secure. We've also been promoting the restart grants to businesses and along with the COVID marshals, how they're assisting with kind of the public and businesses on how to adhere to the guidelines as we go through. It's already been raised before, but information on the lateral flow tests, such as the home testing kit and the community collect, have also been shared. The website has been updated with information. And today there has also been an update on a mobile collection service that's to the east of the district as well. So that's really helpful. So all of the time slots and days are all completed on that list that's on the website. We put together a COVID-19 letter for parents that the school sent out, which was just advice on sort of testing, self-isolating, but also still making sure that everyone's kind of adhering to the rules, even though we're in the Easter holidays, just to minimise the spread of the virus. We also have our specific COVID-19 residents newsletter that goes out every week. And for those that aren't subscribed, I would just encourage you to go onto the website and subscribe to that. It's free and it's weekly, and it's just got a wealth of information on there that's really, really helpful for residents and for businesses and for those out in the community. Ramadan information has also been shared with residents and community group leaders. So this information just contains guidance on how to keep safe and obviously not meet indoors with family and friends, but also that taking the vaccine does not invalidate the fast. So it's acceptable, and that they just keep to their appointments and actually take up the vaccine as well. We've put some comms together about parks and countryside. Obviously the weather is kind of getting better randomly with the snow this morning and then pure sunshine this afternoon. But it's mostly about, you know, kind of taking your rubbish home with you and not leaving it there, classed as fly tipping. And also staff have obviously had to self-isolate or they've had COVID. So there's been a shortage, hence why there's been a delay in some of the bins getting emptied. But, you know, it's really kind of the responsibility of residents to actually sort of take their rubbish home as well, if the bins are full. We've also got members of our public health team who are joining a community forum on the 30th of April, and that's about mental health and its impact during the COVID outbreak. And so we've just been promoting that. And then finally, Lynn's going to be hosting a Facebook Live on Thursday at 5 o'clock, which will be just taking questions from the public and will be an update on our kind of COVID road to recovery as well. And that concludes my comms update.
And I can't see that anyone is dying to ask you a question, which is excellent. Thank you, members. Future agenda items, I'm not going to deal with that now. If members have anything they think could usefully be on a future agenda, could they email Gordon, please, and copy me? Any other business? Looking for hands. Excellent. That's what I liked. Oh, you see,
Sorry.
Mandit, you spoilt it there.
Sorry, I'm really sorry.
Carry on, Mandit.
I was just to say that this is probably going to be my last LOEB, and then Martin's going to take over just as I carry on with more business as usual stuff.
Well, can I thank you? Thank you for your assistance. You've been it's been a delight having you, and certainly you've had an awful lot to do in relation to COVID information. So thank you, Mandit.
Thank you.
Members, I'm going to close the meeting. Can you stay in the meeting until it's confirmed that it's no longer streamed?